You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says that nobody should be wearing a loose-fitting denture. He is Idaho's dental implant dentist, Dr. Jacobson. Dr. Jacobson, welcome to the program.
Thank you.
All right, now I know you brought a lot of photos, and we'll get to as many of those as we can, but for people that don't know your practice, like who's the typical dental implant patient?
You know, the typical patient that comes in is someone who's maybe missing one tooth or a couple teeth, and we're able to restore those teeth, give them their teeth back.
Okay.
There's also the patients that maybe they have several teeth. Maybe they're loose, they hurt, they're in pain, and they've been told by other dentists they have to have dentures. There's no other option. They come to us because they want something else, a different option, and we're able to remove those teeth and the disease and give them implants and give them their teeth back.
Okay.
And then there are other people who went ahead, right, had their teeth pulled out, and they have dentures now, but they don't like the dentures. They don't like the maintenance that comes with them, the way they fit, the way they move around, they pinch all the time. So we're able to give them implants and give them snap-in teeth, just the way they used to have teeth, and they can chew so much better. The denture wearers, I'm excited about them because we can help them the most. I mean, the simplest way to do it is just 2 implants, 1 on either side, and now the denture snaps in. It's like snap in, snap out teeth. Even better than that, if you do 4 implants, 2 in the front, 2 in the back. Now it's really stable, and they can eat anything, corn on the cob, carrots, any type of food they used to enjoy. Above that, you can give them new teeth, porcelain teeth, fixed teeth that don't come out. No cleaning underneath them. You
Sounds
brush
like
and
what
floss
everybody
them.
wants is that, right?
Right, that's what they were used to when they were younger, and that's what you want. It gives you a youthful appearance, beautiful teeth. We can design it to fit their face, the color of their skin, and it's transformational.
Now, are there a lot of people, you mentioned the denture wearers, are there a lot of denture wearers in Idaho?
There's a lot of denture wearers. I see them all the time, and it's because traditionally dentists, that was their solution, take out teeth, build dentures. So there are a lot of denture wearers.
Like what, thousands of them?
Thousands of them, probably fill our local football stadium full of people that just have dentures and are just dealing with that uncomfortable condition every day of their life. In fact, I could probably fill that stadium 10 times over with the people that are headed towards dentures. They have bad teeth, gum disease, pain, swelling, and they don't like the dentist. They don't want to go to the dentist. Those people, I can make a big change in their life.
Now, if dental implants are so good, as like you say they are, why aren't all these people coming in to do it, getting a brand new set of teeth?
Sure.
What's your take?
It's because they're not going to the dentist. They don't know the changes that we've had with dental implants. There's been so many developments in the types of implants that we can place, how they connect, how you can get snap-in teeth, how you can get fixed teeth. They just think that that's their life, that that's the way it's going to be for the rest of their life. And it doesn't have to be that way. The reason why they don't come into the office is because they've had bad dental experiences in the past. I mean, I hear all the time, I don't like going to the dentist. And it's because they had to have teeth removed. They had root canals that failed.
We're talking about the denture wearers.
The denture wearers.
So the last thing they want to do is come see you.
That's how they got to be denture wearers. They lost progressively teeth, or sometimes all their teeth at once, but they were in poor condition. And they don't want to go back to the dentist. When they had their dentures placed, they were kind of happy that day because they said, I'm not going back to the dentist now. But then they accommodate and they get used to it and they start using adhesive and different things like that. And I think this is the way it has to be. And it doesn't have to be that way. So simple, just 2 implants would change your life. 4 implants would be amazing for you. And fixed teeth would be like turning your life back. It's like you become younger, you become more vibrant. It changes your life.
You were telling me in the green room, you say, and I'm paraphrasing you slightly, but when it's all done, it's like they're brand new. It's like they're back. Elaborate on that.
Yeah, they're back. They do things that they weren't doing. They pick up golf again.
Because of what? Their self-esteem?
Their self-esteem changes. I've seen patients get married, right? And go out and meet people, pick up the hobby they used to do, travel more. They go out to dinner more. You know, you don't go out to dinner if you have dentures. You don't want to go out with your friends. You're eating carbohydrates, soft food. You're the potatoes and the soup, you know, on the menu. You get snap-in teeth or fixed teeth. It's like, man, I want a steak, you know, and I want the vegetables with it, and I want corn on the cob. I want to go to the fair and eat fair food. It changes. I mean, and that makes you happy. That's what part of life is. I mean, eating food is a lot of our life, all right? It's social, it's engaging. That's what we enjoy doing. Back to your original question, why aren't all these denture wearers coming in and having this done? Some people think they're too old.
How old can you be to do it?
You know, my oldest patients are in their 90s and they're vibrant.
90?
90.
Why would a 90-year-old want to do this?
Because they don't want to feel 90. They want to feel younger. They want to feel vibrant. I have a patient that's in her late 80s who exercises, and one of the exercises she does is dodgeball. I mean, who that's 89 years old goes to exercise and does dodgeball? And she has several implants, and she smiles, and she loves it. And most people don't think she is, you know, in her late 80s. They think she's in her 60s, right? 20 years younger. Who wouldn't want to be 20 years younger? That's why they do it. And they want to eat and chew. I mean, your whole life revolves around having family over, having your grandchildren there. If you're 90, right. People bring you food. People want to go out to lunch. You're not working, right? So let's go out to lunch.
Are they more likely to fall out or something if you're 90, like getting dental implants?
Oh, yes. If you have dentures at 90, they're almost always out, right?
But I mean, the dental implants, are they more likely to fall out if you're 90?
No.
Oh, really? Okay.
No, because the body has a great affinity for implants. It loves the titanium in implants. It grows right to the implant and makes it solid.
The bone does.
The bone does. The bone in healthy patients just grows right around the implant.
So it doesn't matter how old you are.
Doesn't matter how old you are.
Now, we should mention that dental implants are not covered by even the best dental insurance. Just covers a very small part. And Medicare, Medicaid does not cover this either.
No. But you can finance it. I have ladies that are trained to offer you the very best financing available in dentistry. You can choose your own payment, choose how much you want to put down, and choose the option that we discussed.
Is that common?
It's very common.
Like every day they're doing this?
I think it's every day because a lot of people need a monthly payment in order to get the dentistry done they want to do.
You have to have what? Decent credit? Because you're using lenders, right?
Decent credit, yeah, lenders. But you know, the one that we really prefer has 0 interest for the first year. So if you spread it out over a year, you can do the kind of dentistry that you want to do that I'm going to be showing you.
So no more dentures?
No more dentures.
Do you think you could wipe it out in Idaho?
Of course, yeah, I could. Well, I'd need some help, but I could do it. I could do a large portion because they deserve it. They deserve so much better. It's so old-fashioned to do, you know, just regular dentures.
So do you think this is the future of dentistry? That means like dentures as we know them today, like 20 or 50 years from today, they'll be gone? Like they'll all be attached to implants?
I tell patients, the things I can do for you today, I couldn't do for you 5 or 10 years ago. So I really think the future is no more dentures. Let's have fixed teeth. You see, it's revolutionary right now in dentistry. Put in 4 implants and have fixed teeth. Put in 4 implants on the top, have fixed teeth. Why wouldn't you do that? Finance it and do it today. Make the change in your life. You know, I read a quote recently that said, you know, when you get that feeling that it's time to make a change in your life, you just need to trust the magic of new beginnings. You feel that in your life and you're like, it's time for me to make a change. And the technology is here today to do it. You know, I've had patients that were already wearing dentures and said, I don't like this anymore. I don't like it because I can't chew what I want. It makes funny sounds, it pinches and everything like that. And they came in and we placed 6 implants on the top. We let those implants grow into the bone and then we took impressions and she now has fixed teeth. We actually literally took her denture and threw it in the trash can. You will never need that.
You did that right in front of her?
Right in front of her. You will never need this again. There's no reason to take it home. Just throw it in the trash right now. We're done. It's over. And she just went out with this beautiful, brilliant, smiling teeth, and that was 10 years ago. And imagine what we can do now, even better.
Now, most of these people say, I should have done this a long time ago. Like, I wish I would have done this years ago.
The regret is I should have done it. I should have done it sooner. I didn't realize it would be this transformational. I have a patient that he had a partial denture, right? He had missed some teeth. And sometimes those patients, they're kind of tricky. They could develop into being a denture. They know they don't want a denture. But he would bite his cheek, bite his tongue all the time. 15 years of putting up with that. He came in to see me. I said, look, you can be done with that. Implants and teeth, fixed teeth that don't come out. And he did it. I called him. I said, hey, how you doing? He goes, you know what? I've never even thought of my teeth since you did that. It's been life-changing. And I have not bitten my tongue or my cheek a single time since you did that for me. In fact, I got his picture right here.
Okay.
Here he is. You know, when he first came in, he said, I just want something that works. I don't care what it looks like. I don't care what color you make it. You know, I just want it to work.
So what, he had a denture walking in your office?
He had a partial denture that pinched his tongue and his cheek, and it just hurt all the time. 15 years, He's making changes in his life. He just moved into our area from Alaska, and he said, I just want something to work, so I'm tired of this. I said, dental implants are your answer. And we can get rid of the partial. And one afternoon he comes in, he's wearing the partial that pinches and hurts. We take that out, we put his new teeth in. He smiles, wow, you made them nice, and they match my teeth, they're beautiful. And like I said, and you won't bite your cheek and tongue. And we took his partial, literally brought the garbage can over, said, throw it in there, you're done.
So he did it.
He did it. I put it on our Facebook page. You can go and watch it. And it was right before Christmas. I go, you have new teeth for Christmas. Throw that thing away.
Is there, now how soon can they eat? I mean, if everything works out.
Oh, that night. Oh yeah, you can
okay.
eat when you have implants and real teeth put back in your mouth. It's steak that night. It's dinner tonight. Anything you want.
Is that right?
They're ready to go.
Are they ever worried about it because they've gone so long without eating like chewy foods? Do they ever call and say, Doc, are you sure I could eat this?
Oh yeah, they're a little hesitant, but I say, go ahead. Sky's the limit. Just eat whatever you want. Implants are so strong. They're stronger than teeth. When they're locked into the bone, they're unlike teeth. They don't have to have root canals. They never get cavities, right? That could be your sweet tooth for the rest of your life, right? So there's so many advantages to implants. I truly tell patients all the time, it is like turning time back for you. It's back the way you used to be.
So what do they like more? Do they like the fact that they could eat and chew whatever they want, or do they like just the looks?
People are different. Sometimes they say, I want the eating and chewing, of course. Some people say they want the looks, but I find that all patients with implants actually get both. And sometimes it surprises them. Wow, it eats and chews and it looks great. I got a bonus, right? I got even more than I bargained for. And that's really fun to see.
Okay, good. Now you have other photos, so what are we looking at?
Here's a guy you got to look at.
All right.
I'm excited to show you this case.
Oh my goodness.
It's one of those stories where you just have to hear. You know, good friend of mine, I met him, and he smiles like this, covers his face. And you look at him, you're like, why does people do that? It's because they're embarrassed. They don't want to show their teeth. They have a hard time smiling.
Now that's pretty bad, by the way. That's got to be unusual.
It's not unusual. We see it all the time, but most people don't see it because everyone covers it up. They make their lip kind of long. They don't smile. Someone smiles at them, they don't smile back. So that's why people think it's unusual.
So like I never see it just because these people don't smile.
You don't see it, but I'm a dentist. I see it every day.
Okay.
I see it all the time.
Do they say that? Like, Doc, this is the worst?
Yeah, they tell me that all the time. Hey, I bet you never seen teeth this bad. And I'm like, well, actually, the lady this morning had worse teeth than you, right?
Okay.
But we see it all the time. But I get excited because I see that, but I see in my mind what it's going to look like after. And I get excited.
So with this guy, what were his options?
You know, there's a lot of options. Like I said, I think patients deserve options. They like to hear the options. And I always recommend the very best. For this particular patient, his options were, you could have a denture made. All your teeth out, have a denture. He didn't want to do that. People don't generally want to lose their teeth. They're emotionally connected to them. He wanted to preserve as many teeth as possible.
So you were able to save some of those teeth? Because they look pretty far gone.
I saved some of those teeth. I saved the strongest teeth. I took the ones out that weren't savable. And I said, you have to have these out because it's going to save you from having infection and pain. Okay. And that's what we always want to do. And then we prepared the teeth. And that night, he had a completely different smile.
Wow.
Even when he had temporaries, it's completely different. He's eating. He's like, Doc, this is so much different. I said, oh, you just wait. The best is yet to come. When we put your real teeth in, the porcelain bridge work and the crowns, it's going to look fantastic. And we did. And now he can actually smile. His lip goes up. You know, a nice girl smiles at him. He smiles back. Now people are seeing his real personality comes to life. And it's a transformational change. And it's just so exciting to be a part of that. It's what I enjoy about dentistry, being a part of that in people's lives. But look at the difference after. He's a different person. It's not just the teeth.
His appearance has changed.
His appearance has changed, but it's not just the teeth. It changes them inside. They become more confident, more outgoing. They look more educated. They look more sophisticated. You know, studies have been done. 2 people go in for a job interview. One person has really nice teeth. The other one maybe doesn't, right? Who's the person who's more likely to be hired? The studies show the person with a greater smile. Is it just the smile? No, it's the way they present themselves. I'm more into being hired for this job.
It makes sense. I mean, look, it's not necessarily you hire the prettier smile, but if one is smiling and one isn't, you hire the one that looks happy, you know, self-confident, well-adjusted, positive. So I guess it does matter. You know, we were talking about Hollywood on the phone. You know, in Hollywood, if they want to make you look poor in a movie, they give you bad teeth.
Sure. All the villains have blacked out teeth or flat teeth or missing teeth. Or remember years ago, they had the Billy Bob teeth, right? send on for Billy Bob teeth for
Like a
Halloween.
buck teeth, kind
Buck
of.
teeth, right. If I was here on your show and I had Billy Bob teeth, you'd go, wow, he's a dentist, right? Why does he have teeth like that? And so it's just natural for us to make impressions like that. So why not change your smile? Change that first and let that change the rest of your life. I see it over and over again. Look, here's another one.
All right.
Here's a guy who, he was in his late 20s, right? Not married. And he didn't like his smile. And he came to me and said, Dr. Jacobson, I don't care what it takes. You got to change my smile. I think that's what's holding me back. I said, let's do it. And so we worked up a plan. It involved dental implants, moving his teeth, changing his smile, new crowns on the front. And look at the after picture.
Wow.
Look at this guy. He smiles differently. Look at the way his smile follows his bottom lip in a natural curvature. He has a hard time smiling. Look at the muscles, they're so tense. I mean,
in the before.
Yeah, he's being coached. Come on, we need a smile. We need a smile for before, after. He can't do it. Afterwards, boom, just so natural. Hey, smile for us. Boom, the smile just lights up the room.
And one day.
At my house a few months later, I get a wedding announcement. He's married. Changed his life forever. Now he's got a sweetheart that he can smile to her, she can smile back, and it's just life-changing. So here's a perfect example, right? The smile was holding him back. He wanted to achieve different things in his life. We changed the smile, he changes his life. And there we go. It completely transformed his life. You know, I don't know if he got married because of his smile or his transformation, but he did become more confident. And he became way more relaxed and smiling and showing his personality to other people.
You know, confidence is attractive. There's no doubt about it.
Exactly. And that's what we like in life, right?
So there's that many people that literally, say, I hate my teeth. I mean, there's a lot. I mean, it's very common.
There's a lot of people that
Just
say
don't
they hate
like
their
their
teeth.
smile.
Right. And a lot of times I have to kind of coax it out of them. Sometimes I say, is there anything you want to change about your smile? Well, yeah, I'd like to change this or I'd like to change that. We can do that for you. Let's talk about it. Let's put a plan together. Let's provide the financing that makes it all possible, and let's do it.
Okay.
Here's one more story. You know, this lady, she had lost some teeth in the back, right? Which is very common. People lose back teeth, some people lose front teeth, but back teeth are very commonly lost. And so their options are partial dentures or maybe a full denture. She didn't want to go that direction, did not want to do that. The thing that patients don't realize about back teeth, that's where we do the majority of our chewing. They're built to take a lot of force. And when you lose those back teeth, you think, well, no one can see them, right?
Yeah.
They're back in my cheek. No one can see that. A lot of people say, oh, I'll only worry about my front teeth. Go ahead and take the back teeth out. That's a big mistake. When you lose those chewing teeth in the back, now you start chewing on the front teeth. Guess what happens? Start to get space in the front teeth.
Well, they flare out.
They flare out.
Interesting.
The teeth start getting mobile. And then they'll come in to me and say, I didn't used to have this space between my front teeth. Now I do. What's wrong?
So holes in your mouth in the back will make the rest of the teeth shift.
Of course. This is why
Just a matter of time.
I tell patients this all the time.
Right.
Imagine a bookshelf and it's full of books. I take one big book out of the middle. What happens? The books tip in.
Less stable.
Yeah, less stable. The books on the side tip in.
Good point.
And then I take another book out. They tip in even farther. That's what happens with your teeth.
So is that what was going on with her?
Exactly.
Okay.
But we caught it early. She started to notice changes in the front of her mouth, and I taught her that it was the back teeth. I said, look, 2 implants, 1 on either side, you can have your teeth back. We can reverse the process. She goes, I got to do it. So we did it, and she's loved it. And
The chewing. I mean, she could chew
she can
so
chew
much better.
again. Brush and floss the teeth like normal teeth. No cavities to worry about on the implant teeth, like I said. And now it stopped that. Now the bookshelf was full. Nothing's going to move around. It's stable, and it'll stay that way the rest of her life.
Is it like a third set of teeth?
It is like
in a way?
It is like a third set of teeth. You have your baby teeth, you have your adult teeth. You know, sometimes I tell patients, kids, they got to learn how to brush, take care of their baby teeth. I do a lot of kids in my office. I mean, my wife and I have 6 kids. I enjoy kids. But, baby teeth are for learning, right? Adult teeth, you need to take care of those, but some people haven't learned yet, or something happens, I had a patient, she is a brilliant soccer player, playing a competitive game, hits another player, wipes out all of her teeth right in the front, top and bottom. The best chance for her, she's only 18, 19 years old, implants. Put her smile right back to the way it was. She has beautiful teeth the rest of her life, right? So implants are such a great tool that dentistry has today.
Now, we should mention, you've been doing this for a long time. Is that right? You've
Yes.
been doing implant
Yeah.
dentistry for how many years? Almost since it started.
Well, my dental school, Creighton Dental School, was the first dental school in the country to teach dentists in training how to place implants. I had a classmate who's missing 2 front teeth right here, never had them, never grew in. And so I placed his implants and I restored him. And by the time we graduated, he had a full smile, loves it. I see him once in a while at different dental committees, meetings, and he's so grateful to have those teeth. You know, there's something else we need to talk about.
Okay.
Sedation. I hear all the time, I'm afraid to go to the dentist. That's why I'm not going to go. I'm anxious about it. I have bad memories from when I was younger. I used to think I could be a great dentist and I could erase those memories from their memory bank.
All right.
And they would just say, wow, you're the greatest dentist. I have since learned that's only possible one way, sedation.
Is that right? Okay.
You take 2 small pills and then come to my office, you have very little memory of the entire procedure that we do. You have someone that drives you there, drives you home. We monitor your respiratory rate, your heart rate.
You do IV sedation as well?
We do IV sedation. IV sedation is even better. I can give just the right amount of medication so that you basically sleep right through the whole procedure. You have no memory of what happens. We can place the implants, remove the teeth, and you don't get the memory. You don't get the anxiety. You don't have to think about it later. That was, you know, a difficult procedure. It's not even in your memory bank. It's gone. They're not technically asleep. They still respond to verbal cues. If I say open your mouth, they will. Close your mouth, they will. So it's a level of conscious sedation that I'm certified to do. In fact, I've done training for other dentists.
So you teach other guys sedation?
I teach other dentists how to do it.
Like less than 10% of all dentists, general dentists, can even do sedation?
Very few do it. You have to go to a course. You have to be trained to do it.
So you have to have a special certificate to do this?
You do have to have a special certificate through the state of Idaho in order to do that. And I have that. I do continuing education, so I stay up on it and the latest advances on how to do sedation. And I have a lot of experience doing it. I've done it my entire career. Patients love it. I call them that night after I do the procedure. How were you? I don't remember. I feel great now.
Right?
Did you have dinner? I had dinner. It's great.
Okay, we're short on time, but let's talk about options for denture wearers or people that are about to lose all their teeth. So 2 types of patients. In your office, you can't save their teeth, all their teeth have to be removed, or the denture wearer. What are their options when it comes to dental implants?
All right, here's the options. Really simply. If you have a denture, 2 implants. Works pretty good. Way better than just dentures that move around. See, the tongue's in the middle, and the tongue's job is to put the food onto the denture. But every time the tongue moves, the denture moves. And so you put 2 implants in, they stick up through the gum tissue. Now it can't move the denture.
You just snap
in, snap out. That's great. A huge improvement over just a loose fitting denture. But even better than that, put 2 in the front, 2 in the back. Because the 2 kind of rock front to back. But if you put 2 behind it, now it doesn't rock as much. Even more stable.
So that's a better option.
Way better.
Okay.
Yeah, greatly improved. The best option, take those 4 implants, but put fixed teeth on them. Now they don't come in and out at all.
So you could get a full arch of teeth?
Full arch of teeth. Take the denture, 4. Throw it in the trash, you're done. Never gonna see it again. Full arch of teeth, brush and floss like normal people, smile like normal people, eat the food that normal people eat. Eat like you used to eat.
Now what about the upper though? Isn't the upper fine because of the suction of the upper?
Oh, a lot of people say, I'm pretty happy with my denture, the suction on the top. But the reality is, they're not. Because that palate, when it's covered, you can't taste your food. You can't tell the temperature of it. You know, when you taste wine and different things like that, it's the palate where all the sensation's at. So they say, well, can't I have a denture without a palate? Well, that's very difficult to do, but you can have fixed teeth. Put in 4 implants or maybe even 6. If you have the bone that's there, the sinuses can be lifted up, or we can take 4 and just put a full arch of teeth. Fixed, never come out. My own father, when he was younger, was breaking a horse and it was bucking, and the head of the horse came back, knocked him in the front of the mouth, knocked out several teeth. Started off with a flipper, didn't like it, moved around, it pinched. Then took out a few more teeth, made a partial, didn't like it, moved around. Finally, you know, his mom had a denture, I'm just gonna get a denture. Had a denture made. When I was younger, I didn't even know my dad had a denture. Then later on I find out, oh my goodness, he has a denture.
So you're a dentist now, out of dental school, and your dad's wearing a denture?
Yes.
So your goal was what?
My goal was to change his life by doing dental implants. I said, Dad, I'm ready to do it. I know how to do it. Let's put dental implants in. I put in 6 dental implants on the top, gave him snap-in teeth, changed his life. He could eat firmer foods, corn on the cob, vegetables. He wouldn't take his teeth out anymore because they felt so natural. Just leave them in all the time. And you know, he thought the same thing. I'm too old, I've been wearing denture too long, I don't have enough bone. Because of the smaller implants, we were able to do it. Didn't have to have bone grafting, didn't have to have sinus lift, didn't have to have any of those things. We were able to put it in there. It's been years now, and it's been life-changing.
Was he sedated? Did you also do sedation on him?
Did sedation on him, made him very comfortable, and the procedure was done in literally under an hour and a half. We were done.
Now, because it's your dad, how long did he have a denture before he got his teeth with the dental implants?
Decades.
Okay, so 20-something years.
20, 30 years.
When it was all done, did he tell you, why didn't you talk me into this earlier?
Yeah, that's always what I hear from patients, and my dad as well. I should have done it sooner. I should have done it sooner. But I'm so glad that I did it.
Is that right? So no more dentures. Nobody should be wearing dentures.
No one.
So tell me about the consultation. So somebody watching this, they call you and they get to see you on the consultation.
Absolutely.
And how soon before you know whether or not you can do it? Like whether or not they're a candidate?
That day. We take a few images, I examine them, I look at the bone, I give them the options. We know that day. I can see, because I've done it so much, I can see the results.
You see that in the result?
Either pathway they choose, I see how it's going to be. And I give them the pros and cons. If you choose this pathway, this is how it's going to be. I know that from experience. Choose this way, this is how it's going to be. I'm going to give you my best recommendation. Do fixed teeth. Do implants, do fixed teeth.
In one day?
One day, you'll never regret it. You will thank me over and over and over again that I gave you that option.
Now, look, you've been in Idaho for a long time. A lot of people know you. Do you ever get stopped, like where somebody comes up to you and says, "Oh my goodness, I love my teeth," or "I love what I could eat"? Does that happen?
You live in California, I live in Idaho. I like to meet patients, see them in the grocery store. They come up to me, they thank me, they meet my wife, they meet my kids. They say, "That's my dentist. He's the guy that changed my life."
That's nice.
To me, it's just that little bit of fame, a little bit of recognition, a little bit of thanks and gratitude that I enjoy. It's why I'm in dentistry. It's what I enjoy doing.
But this is the happiest group of patients. I mean, when you give somebody their teeth back, is that like...
They're the happiest group of patients. When you have a cavity and have it filled, yeah, that's just normal stuff, right? It happens. I've had cavities filled, right? It's part of life, right? We're human. But when you give people teeth back, it changes their confidence, it changes their smile, it changes who they are, it changes what they can do. It is way more than just having a tooth filled. It's so much more.
We're out of time. I want to thank you for coming on the show. Good stuff. They can go to your website, learn more about this, make an appointment there.
Yes. Our ladies are very trained. They can talk to you on the phone. They can answer many questions. You can go to the webpage. You can see pictures of patients that I've done so you can see the work that we do. And we would love to have you come in and just visit, get to know you. Let's make a plan.
The denture wearers that's watching this, literally next month, they could have a brand new set of teeth, upper and lower, that don't come out. If everything works out right.
In the same day.
Okay.
Come in, do the consultation. The next appointment, you're going to have it. You can have teeth that are fixed, stay in your mouth the very next time.
All right, good for you. Thanks so much.
All right,
good
thanks.
stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.